You are in financial navigation. I am Yolanda Hildenbrand. I am a social worker and a therapist out of Louisville, Kentucky. So I work at Norton Cancer Institute. There, I provide therapy services to our oncology patients, as well as some financial resources, which I'm not the key today. These ladies are, but I'm sure they'll have plenty of information if they leave something out or if I just get a little jealous because I'm not intercept. So we're going to get started. At the end, we'll have time for questions. So I'm going to pass the mic, and these lovely ladies will introduce themselves and where they're from.
So hi, my name is Donna Thompson. I'm from Philadelphia. I am in my 11th year of survivorship with lung cancer. And professionally, I am an HR director for an organization. And I work with other advocacy associations related to lung cancer awareness, spreading awareness, building communities of support. And yeah, that's about it.
Hi, I'm Daphne Morrison. I am the Research Development and Analyst Specialist for an organization called SWALC, Southwest Louisiana Area Health Education Center. So I am local in the state. And so I serve as a research and development, but I also work with a very important program for Louisiana called the Navigators Wealthy Louisiana. So to give you a little context, Southwest Louisiana Area Health Education Center, we are a nonprofit organization. We are supported by the U.S. Department of Health and Human Service Administration. And so we work not only in Southwest Louisiana, we work statewide as well on several programs. We're part of a network of AHECs across 48 states, and we have 4 AHECs in our state. We are the largest. We've been here for 35 years, and so we've been here a long time. And so we do a lot with healthcare access, and we do a lot with workforce development. We also work with anywhere from maternal services all the way from substance abuse. We have 30-plus programs that we do facilitate, and they're all funded by either state funding, federal funding, foundational funding, contractual funding. We have state contracts. So we're here to improve the health outcomes. And so we're here to fill the gaps in the state. And today I'm already talking about the Navigators Wealthy Louisiana program. And so we assist cancer patients, community members with access to healthcare resources such as Medicaid and the marketplace. And so we specifically help with renewals, applications to assist with that. And so we're here to support through treatment and survivorship. And there's a lot's changing right now, so that's why I'm here today to help navigate through all those changes.
I definitely sat in the wrong seat to follow that. I'm Megan Broussard. I am the lung cancer screening program coordinator for St. Tammany Health System, which is just on the North Shore of Louisiana. And I'm I can help you with financial assistance and resources and stuff for screening and getting the diagnosis of your lung cancer.
Okay, so we're back to me now. I like holding this mic doing this. So the way we're going to do this is I've written down some questions, and these are the questions that I believe that most patients or caregivers or family members would ask as it relates to navigating the financial aspect of lung cancer, pretty much any kind of cancer, to be completely honest. Okay, so if you have someone that doesn't have lung cancer but maybe has another form, this information may be just as helpful. So the first question I have for these ladies, and we'll go down the line, there's going to not be a right or wrong answer. It's probably going to be very diverse, built on what these ladies have done, okay? So the first question, what is the biggest obstacle related to financial navigation that you see with patients, families, caregivers?
I just think knowledge, knowing where to go for support, knowing what support is already available to them, especially if they're still working, like I said, from me working in HR, and then my own personal experience of navigating, FMLA with short-term disability or long-term. And I think a lot of people just aren't aware of what workplace accommodations they qualify for as well. Mm-hmm. And so maybe they stop working and lose their income because they don't realize they could do both. Yeah.
That's great. That's great. From our perspective, we are the Center for Medicaid and Medicare Services, Navigators for Healthy Louisiana. We're funded by Center for Medicaid and Medicare Services. We work with about 500 organizations across the state and all the cancer centers. From our perspective, after working with thousands of cancer patients and survivors and caregivers, we've been doing this for 13 years, so we've been around a lot, is that often patients are facing a health crisis, but they're also sometimes facing financial crisis, but health coverage issues. You know, like what Donna was saying, what if they're not working anymore and they lose their employer-based coverage? What do they do then? And so they're often, going through this journey and they have an interruption in their income, interruption in their coverage, and then they don't know how to access health coverage. They don't know what's available to them. Sometimes they go directly to the financial assistance at a hospital, not realizing there's other resources that are available through the marketplace or through Medicaid. If their incomes change, you may be eligible for something else. And so that's why we're here, is that we see those obstacles, and it's also a lot of changes with the eligibility. You're going to hear me talk a lot about changes with Medicaid eligibility and changes with marketplace. It's overwhelming, especially with a patient that's already got stress and emotional, just emotional over the whole system, and you're overwhelmed by it, and then you're wondering, how am I going to pay for treatment? How am I going to have it covered? I'm not working anymore. What's going to happen? And so that's why we're here, to walk you through every step of that journey and those obstacles.
On my side, I think the biggest barrier is the education for the resources. A lot of people don't know that they can get lung screenings for free. It's preventative care. CMS covers it in the state of Louisiana. Medicaid covers it. Most private insurances cover it. And then we also have a partnership with the American Lung Association. So if you do have a copay, they will cover that. Or if you're uninsured, they will cover you to have those screenings. The biggest gap in care on my side is between that initial screening and the diagnosis at the cancer center, because we have all sorts of resources once you get into the cancer center, but it's that gap in the middle where your doctor wants an extra scan. They want to monitor it. Well, it's not covered under screening, and it's not, you're not in the cancer center to receive those financial benefits. So you just need a follow-up, and those often mean like big copays, like $350 or something, just to find out. Plus, not to mention the emotional tax of waiting 3 to 6 months to follow up on something that they've seen. And so that's the biggest barrier I see. And patients often skip that scan because they can't afford it, which results in upstaging and finding their lung cancer later when it's harder to treat. So my goal, and what we're really working at our health system, is using our foundation and the funds that we raise to help patients pay for that. But like most health systems, there's, administrative barriers, there's insurance contracts. So that's the hardest part that we're dealing with, but we are doing it. Like, we're fighting for it. We're trying to figure out a way. So yeah, I think that's the biggest.
So listening to some of the answers given, if I'm thinking about my patients at home, and I say my patients because I love them, so they're my patients. Mm-hmm. One of the biggest obstacles that they have is the marketplace, okay? And they believe they don't qualify. And I always push them, first I push Medicaid. And I know everybody's not going to qualify for Medicaid, but I push that one first because a lot of times the hospital financial is linked with Medicaid, meaning the income is about the same. So if you qualify for Medicaid, you usually qualify for the hospital-based financial assistance. However, a lot of times it doesn't happen that way, but that's mostly what I do, is I try to get them to do Medicaid, then we go with the hospital-based. Then after that, we go with Marketplace. Are you guys familiar with Marketplace? No? Okay, so she's going to be able to. Look, I'm throwing you right there. One thing I'll say about Marketplace, and I push people, and you can tell me if I'm wrong here, but the thing about Marketplace, and we also call that Obamacare. I have a story about that. A patient, he was not an Obama fan, okay? So he refused to apply for Obamacare, okay? And I got these doctors on my back trying to get this because he needed it, and he needed it quick. And I kept thinking, what can I do? What can I do? What can I do? So then I kind of smirked, and I waited a couple days. And I called him and I said, "Hey, it's Yolanda. Look, I know you didn't want to apply for Obamacare, but I got something else." And he says, and he's like, "What?" I said, "Have you heard of the Affordable Cares Act?" And he's like, "No." I said, "Let me tell you about it." And I told him, okay, and he applied and got approved. And I waited till he was halfway through with treatment. And I said, "I got a secret for you." And I said, do you like me right now? He said, "Of course, I love you. You saved my life." I said, "Okay. Remember that Affordable Cares Act?" He said, "Yeah." I said, "That's Obamacare." He turned beet red, y'all. And then he said, "Thank you," because I was being ignorant, right? So I say that because some people, that's their thing, right? They'll put politics into it. I don't care who it is, all day, every day. If I need insurance, I will apply for market care. I don't care if it's Putin care, okay? I'm going to get it. So, but can you talk just a little bit about the marketplace for us?
So the federal health insurance marketplace, it's been around for 13 years. I won't say, yes, it's been around 13 years. And so it was called the exchange at first. It is private health insurance that is federally subsidized depending on your income. Okay, and so it is available to anyone that doesn't have employer coverage or is not eligible for Medicaid. If you're $10 over Medicaid limit, $100 over, you probably will be eligible for the federal health insurance marketplace. And it's just like almost employer insurance. You know, whatever you get an employer, you may get a Blue Cross plan. You could get a Blue Cross marketplace plan that has great coverage. Okay, so, but it's federally subsidized based on your income. You get tax credits. So it is available to everyone unless you're in those two categories.
So take this information back.
What are those two categories again?
If you're not eligible for Medicaid or you do not have employer-based coverage. Okay, so those two categories, if you already have coverage available to you, then that's when it's, then you can do the marketplace. And that's why we're here in the States. Center for Medicaid and Medicare Services funds us. We're a grant-funded program to help people apply. But like what's mentioned is that we work with about 500 organizations, all these health systems across the state. Oftentimes we find that what Yolanda said is that they will go from Medicaid to financial, if they're not Medicaid eligible, they'll go straight to financial assistance. They don't know about there's other insurance coverage that's available to them. Okay, and that's a lack of knowledge. So thank you so much for bringing that up, Yolanda.
Okay, so next question here. What do you think would help lessen the burden related to financial navigation? And I have a little my answer here, and it says, where should someone start? So from the beginning, finding out you have cancer, knowing that they're going to struggle financially, where would you suggest they start?
Megan, start first
Okay.
here.
My suggestion would be straight off the bat, establish with the social worker at your cancer center. That is their job. Also the navigators that are going to help you make your appointments and stuff. They can educate you on all the resources that are available to help you. It could be transportation, gas cards, food, any kind of issue that you're having to deal with the financial burdens of cancer can be found through your cancer center, social workers, and nurse navigators. The other side of it, like Taffy mentioned, those workplace programs that they'll also be able to tell you about. And then, from the screening side of it, before you have that diagnosis, my recommendation is call the American Lung Association, call the Go-To Cancer Foundation. I have some pamphlets in the back about those are national organizations that want to help you. Call me. My card's back there. I can help you find resources, and or even if you've exhausted all those, call the financial counselor. Work out a $10 a month plan. Just don't skip the diagnosis test. That's so important because it's just going to end in a larger financial burden later on if you don't get that early diagnosis.
Yolanda, I think you're combining two questions here, and so I'll put that together. So basically, I think what Megan has said, start early, connect with that navigator. But with us, don't only connect with patient navigator, make sure you connect with a health coverage navigator like what's available to you in our state with the Navigators Louisiana program. But first, I would reassure everyone, you're not alone. You know, you have so much support through your centers and also through your state that you're not alone through walking through this, getting the assistance that you need. And so, what I would say, what we would encourage is like act early. A lot of times, timely enrollment on our part, you have to act early for those transitions. You got to know when your employer based coverage ends and when you can start other coverage. And that usually is a process. When we're working with cancer patients, it's sometimes a 3-month process that we walk them through the journey, through the transition, so they don't miss appointments, they don't miss screenings, so they have that health coverage that they need. So for us, is that we would help assess and review the coverage you have, what health coverage you have, what is your income going to change? Is it going to go down? Is it going to stay the same? So that's going to help us evaluate what coverage you need if you're going to go for Medicaid or Marketplace or other assistance coverage, and then go to the financial assistance that's available to you. And then we're going to walk you through every step of the process. We're going to make sure that, you know, you fill out the application appropriately. You make sure that you're not missing an appointment, you're not having a gap. Because with Marketplace, if you apply today, what's today? Yep, you'll get coverage the first of the month. That's not the case with Medicaid. Medicaid, it's taking a longer process right now. So you need to start that process early and contact a navigator early. And I will talk a little bit about sometimes when you're losing employers, employer-based coverage, you're no longer able to work because of your diagnosis. So you're offered COBRA. And COBRA, please talk to us before you take COBRA. It's very expensive. Some of the other options that I mentioned to you are much less expensive because of the tax credits. But a lot of times, if you take COBRA, it makes us limited on what you can get as far as health coverage. Sometimes you have to keep COBRA the whole 18 months, and it causes some financial debt, and you can't pay your rent, and you can't pay other expenses because you're paying your medical expenses. So please talk to one of us before you make that choice, and let us talk about the pros and cons of it, because there are other options available that we want to help walk you through that whole journey so you don't have that financial debt and medical debt that's going to cause issues for the rest of your life. Donna.
Oh, sorry.
Donna, I was going to pass it to Donna.
Those are great. So I'm going to pivot a little away from the insurance side and say that when you get this diagnosis, or honestly, every cancer center should have a navigator, but they don't. I didn't have any in my first go around. And so that's one thing, but you can ask for that. If there's a nurse that comes into your room, you can ask them to direct you to that navigator, or whoever, the social worker or whomever it is that you need assistance with. The other piece, dependent on the diagnosis, because we're talking about like losing income, there are certain diagnoses that you're automatically approved for Social Security disability insurance or income insurance. And for instance, stage 4 lung cancer automatically qualifies you. And so perhaps at that moment, you've made it along the journey, the path where you know your diagnosis, you know your staging and all of that, and maybe you're getting surgery or whatever the case may be, and you can't go back to work. So if you are working, but if you are working and there's like short-term disability or things of that nature, you would want to apply for those, because the Social Security disability period does take a little while. I mean, if you're a stage 4, you're automatically approved, but it doesn't kick in right away. But if you're out more than 6 months, you actually, from a disability insurance perspective, you have to apply for the state, federal, the state disability programs. So that's another way to kind of keep the income going.
Look at you. I'm so glad you said that. So, piggybacking on what my sister here was just talking about, which I totally agree, because this is what I do daily. And when I see a stage 4, some stage 3, I automatically, when they say they don't have any money, they're struggling financially, first thing I do is suggest it. Now, some people, they're not ready, right? Because they're like, no, I'm going to be better and I'm going to work. So I kind of push back. Yep. I push back a little bit. But another thing with the Social Security disability that we have to make sure that patients know when they apply for it, it doesn't come with the insurance. So the way that that works is that you have to be on Social Security disability for 24 months before you're eligible for Medicare. Okay, so let's say someone, they get that insurance, they get the Social Security benefit, the financial benefit, they're still gonna have to find insurance, health insurance. So that may still lead them back to the marketplace simply because a lot of times they're not gonna be eligible for Medicaid. So, but,
I wanted to speak to the part when you mentioned people not being ready. And I had a situation like that with one of the things I went through last year. And I remember they kept, every time I walked in the room, they're like, you have this. And I'm like, no, I don't. And later, I was like, that is not what I have. And then later, of course, when I was kind of towards the end of it, one of my, I think like a physical therapist or someone said to me, she was like, listen, let them call it whatever they want. Because by them calling it that, you qualify for these things here. And I'm like, oh, okay, you know? And so sometimes it's just kind of like that conversation to kind of open it up, because I do agree, kind of similar to the Obamacare. It's kind of like meeting people where they are. I'm like, okay, this is assistance that you need, you've paid into, or maybe you didn't, and that, you know, that diagnosis doesn't, you know, make you, but it does help you qualify for some things. So, yeah.
okay. So some of these questions we kind of answered, so it's not a trick bag. I'm just gonna reroute some of them. So let's say, initially, starting with you, Megan. Patient comes in, just diagnosed with cancer. They don't know what to do. Now, I know we've talked about go here, but what would you say to that person that just comes to you and says, I just been diagnosed, where should I start? What do I need to do?
I mean, a really hard question. I can't even imagine how they're feeling right now. But, you know, I think, like you said, like, just give them a minute to process, you know, let them, I guess, absorb what that like overwhelming to-do list is about to be, because it shouldn't be that way. We should have patient navigation everywhere. You shouldn't have to be an advocate for yourself, but we're just not there yet systemically. So, you know, just sitting in that space and allowing them to process and what all of that means, and not, which I'm a fixer. That's why I'm in this job. So it's really hard for me not to be like, okay, boom, 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 boom. So I really have to slow down and just, you know, like meet people where they're at, let them process it. But at the same time, there's an urgency with lung cancer. Like it's a ticking time clock. So the sooner we get started, the sooner, you know, the better the outcomes are. So I think that just goes back to just like, look, you're going to be seeing all these doctors, you're going to have all these things being thrown at you, but that navigator, if you're lucky enough to have one at your cancer center, they're going to be able to answer all those questions. They're going to tell you when your appointments are. They're going to set them up for you. They're going to set up your scans, your tests. Also, again, the social workers, like, they're going to help you navigate this incredibly difficult time. And yeah, just like, I'm here. How can I support? What can I do for you? So.
And I'm going to get out of my zone here, because I used to work with a cancer, directly at a cancer center as well. And so look at support around you, not just out. The patient navigation and the social workers are very crucial to connect and community resources, but there's also support groups. And there's other people who have walked this journey before, like Donna, you know, that you need to talk to. You know, you need to talk to, you need to be a part of that, to know you're surrounded by that. And they're going to give you resources that maybe was missed. You know, that maybe you know, there's a resource, maybe, you know, a food resource, or just, you know, some other emotional resource. And I'd say reach out to those in your community, and even ask the navigator or someone at the cancer center, hey, I just need to talk to somebody, you know, that's went through this journey. And I think that getting that support would be just invaluable during that period.
Yeah, okay. So, piggybacking again, because that's what I do. As far as Megan, I think it's great that you start with the navigator, because navigators, and I'm speaking as far as our cancer center, but most of the time the navigators are who get you to the social workers. Okay, because the social workers, we don't come in unless we're called in, right? So navigators first, you all get the big picture, okay? Then they send them to us, the social workers, so then we kind of assess and see what's going on, what you need. Because a lot of times I'll get patients that have just gotten a diagnosis, so they really don't know what to do. So what I do, I say, I know it's soon. I want you to take some time, kind of absorb everything, then write down what you think you need. And then we go from there. A lot of times, some of our patients, they don't need the insurance, right? Some of them don't even need the financial at this time, right? So what I usually talk to them about, social workers, we talk to them about in the event of, right? So if later you come and you're noticing I can't pay the rent, I'm running out of food, can't get then that's when we step back, we step back in. So we talked about this before. So a lot of times I'll tell a patient, we'll have this whole conversation, and I'll tell them what is available at the time, because we all know that changes. And I'll say, if you get to this point, all you have to do is call me, and if we have it, it's here for you. If we don't have it, we're going to look and see what else we can find. Okay. All right, so next question. What are you guys doing to educate patients or caregivers? We'll start with her this time.
Start with me?
No.
Oh.
Oh,
Yeah.
we're starting with me?
Yep.
Okay, great. We do ongoing education, because we're statewide. Once we work with you as a patient, we keep you. We try to keep you, and we follow you through the whole process. And you can reach out to us because you have someone that's an advocate for you as far as this area. So we go on and on. We do outreach activities. We also have resources that we focus on, and sometimes we connect to resources outside of insurance, like what Yolanda is saying. We'll connect you with a community health worker or someone else that's going to help you with those other resources. But we're going to make sure you have access to care. But one of the big things we're doing right now is landscape changes in our policies far as Medicaid and Marketplace. You all have heard about it. The One Big Beautiful Bill, HR 1, is making changes to Medicare and Marketplace. So we're doing a lot of education on that right now. One of the things that we're educating right now is the work requirements. Those are going to kick in January. That all those that are on Medicaid from 19 to 64, unless you're medically frail. Now, there is an exemption for that. You will have to be able to report work requirements. So that is a part of the bill that's going to change, as well as our annual renewals for Medicaid will go from 1 to 2 times a year. So you're going to get more letters, and they're also asking for more documentation because of the fraud prevention efforts and measures that they put in place. And so those are some of the things we are definitely educating on, as well as if you're a Medicaid member in Louisiana, you have 3-month wage checks. So your wages are being checked every 3 months already. That's in place. So you can get 5 letters a year about your eligibility for Medicaid. Often confusing, often overwhelming, and to be honest, the letters aren't always clear. And so you need somebody to be able to read those and look that and walk you through and make sure that you are being able to maintain coverage. So that's what we're educating a lot on. We do presentations to community groups, churches, healthcare facilities, community organizations. It doesn't matter how many. You can give us 2 people, you can give us 200 people. We are there to educate. And so we're doing a lot of education in our state. And you can find about that education, ask about it on our website, or you can get my card. I'm the one that usually does the education. So just be able to be available for that education. Let me correct one thing with the Marketplace. All of you know that there was some tax credits that were December 31st, they expired. So everybody thinks with Marketplace, I don't get tax credits anymore. It's going to be much more and more expensive. No, there is still tax credits. That was an extension that was given during COVID. So it will be maybe a little expensive, but it's still affordable for those that are in a certain income brackets. So let me just display that right now, because a lot of people aren't even trying anymore because they're like, oh, it's going to be too expensive. No, please check it out. It's no cost. It's worth checking it out to see if that can be affordable to you. And we also have a newsletter that we put out every other month. And again, subscribe on our website. And that gives you all the updates of what's happening in the Medicaid and Marketplace world, as well as we've got resources for discount prescription drugs. We got resources for food. We got resources for uninsured, all listed on our newsletter. So please just look at our website, and I guess I should give that www.getcoveredla.org or www.swla .org or 1-800-435-2432. You don't have to write that down or memorize it. There's a sheet in the back. You can just take that on your way back. And then we also have additional resources on everything I've talked about today on there as well. And there's also a clipboard. You can sign up and just talk to me, and I'll connect you to the right resources.
Oh, am I next?
Oh, I keep
Yeah,
passing it to you.
it's okay.
And I'm saying you've been through it, so what would you say to someone as far as, how would you educate the new cancer diagnosis?
So one of the things, a group of ladies, friends of ours, have started a support group for women. Billy's part of that group. I think it started out with, I don't know, maybe like 5 or 6 of us, and now, I don't know, we're like 30 women, Black women, and they kind of find us through organizations such as this, and, Longevity, Hope Summit, wherever we are. They're like, oh, go look for these ladies here, and they throw out some of the names. And so we have all different, all of us are different backgrounds, different professions. We meet monthly via Zoom, but we have a chat that we're all interactive in, even while we're here, And so for us, it's become one, support, but a lot of women have come into the group maybe hopeless and thinking like, and they come to the group, they see us, they meet us, they're like, stage 4, 11 years, wait, so I have hope. And so it's just been like a really huge community that, and like I said, from resources, from insurance, or from navigation, or just even something scientific. Maybe they have questions about like their biomarkers. Somebody in that group has something that's out there, so we can touch. So even if it's direct into like, oh, this is where you go for information to the marketplace, whatever it is, we are a hub of resources. And so that's where it starts for us. And we kind of are in these stages, and when we have these opportunities, we're like, we need to really make this more official so that there's a QR code so somebody can scan and find us, and things of that nature. So that's what we do. Yeah.
So definitely agree with the groups, and I agree with I push groups to my patients all day. It gets on their nerves. But the reason I push groups is because, like she said, there are several women, men, whatever, in the group. You get information from other people and people that have gone through it. So I have a patient that could tell you every financial resource out there because she's got it all, right? So you go to these groups because one is for support, right? Mental support, financial support, whatever support you need. Most of the time you can get those in groups. So that's why I think groups are really, really important.
And we talk about any and everything. We hardly ever talk about our diagnosis, right?
Which is good. That creates a sense of normalcy.
Yes.
So that's good. Okay, so I'm going to get it down to the last question here, and then we will answer any questions out there for you guys. Let's say someone just comes and they are newly diagnosed, but it's an emergent situation, okay? They don't have insurance. They don't know what to do. They're thinking, just forget it then. And I do have those patients that will say, forget it. I don't have insurance, so I'm not going to do anything. What would you tell that patient?
Okay. Well, I mean, never give up hope, right? But those are just words unless you share something personal with your story. So I would always start me personally with, 11 years, 3 diagnoses, 2 surgeries, just all types of things. But you would never know that unless I told you, And so many women in our group came in and like, oh, this is, you have, I don't know, a year to live, and it's 10 years later, So I think that for me, I would just kind of give those real life statistics, which is why it helps to have survivors as I call myself, advocates, because it's our personal stories. It makes it real. If you just sit there and just spew numbers, they're like, yeah, make it plain. Then we show up. And so for me, it's always that. It's always the presence. It's always making sure no one feels alone, that you feel supported. I mean, many of us, when we were diagnosed early on, I'm like, I don't see anybody look like me. People are looking for someone older, an older man or some sort, someone that maybe smoked, and none of these things. So we don't meet that criteria. Like no one would ever, think that. And so just kind of showing people what hope looks like, not just telling them, but showing them.
Yeah, and as far as emergency response, like Yolanda mentioned, is that, and I want to add to that, because if you're not a group person, there's online resources. There's online support. If you're like, I don't want to sit in a bunch of people and them staring at me, asking me about my story, there's online support that you can do that. So I want to add that to what Yolanda said. But for us, with our Navigators program, we can respond within 24 hours usually. We have very fast response. time, and we're going to start with a phone call. So we can always make a phone call really quickly, and then we're going to make sure that we can assess their situation very quickly, and then we're going to make sure that we're asking the right questions and that you're connected to not only our resources, but other resources in the community as well. So yes, I think there is response that you can do quickly, but you sometimes uninsured, you're like, I don't have the money for the treatment. I might as well not even do. I might as well just go, go in a corner and just let it happen. Or if I ignore it, it's going to go away. Is what often is the conversation. But no, once you make that step forward, realize that there is quick response, just like what Megan said, especially with lung cancer. We're going to respond very quickly to do that assessment and get you the coverage as soon as you can on our part.
So this part is kind of out of my lane because I don't really deal with the emergency situations a lot. But I think what Donna and Taffy both said is so important. Is don't lose the hope. Donna and I both work with GoTo, which will directly connect you with another patient who has experienced the same things. If you don't want to do, or you don't have access to a local group, this is the unfortunate thing about lung cancer, is it's the least funded, it's the most deadly, and it's the least talked about. Like, if you have breast cancer, you can find someone on the street corner. Everybody is gonna, be ready to talk to you and help you and be that support. We don't have that for lung cancer. So it's so important that we have these organizations, these national organizations that are there for you. If you don't have a local community organization that will connect with you and be able to help you.
That's actually, I just want to add one thing real quick. That's actually true. So when I talked about us getting involved with people, it's through those organizations, Longevity. They have these mentor lines, peer to peer, and they'll call us sometimes. Can you talk to so-and-so? And can you connect with this person? And that comes through some health centers or hospitals. So it's like this trickle-down effect of all of these lines, and then you eventually get to someone.
Okay, I'm going to round it up really quickly. But one or several things that I usually say to patients is I always have patients call the American Cancer Society. And the reason that I do that is because they have a plethora of information that they can break down from state to state, from county to street. Okay, so that I always tell them that. And cancercare.com, I always send them there. So those are two that I'm real big on because I've seen things happen. Okay. The other thing I would suggest, again, is a social worker, right? So you don't have a social worker, or, and the smaller hospitals don't. They may not have social workers or nurse navigators. Find you a social worker. And let's say I work for Norton, right? Call Baptist, right? Social workers will talk to you. If you call and say, I'm not a patient, can you tell me where I can go for resources? We're going to tell you. Matter of fact, we'll probably send you something. We'll send you an email. So you don't have to have an in-house social worker, but you can have one. American Cancer Society, they'll find you a social worker. So I don't want anyone to ever feel like they can't get access to a resource. And the main thing is, as far as patients navigating, you're an important part of the navigation tool because there's going to be some work that you're going to have to do yourself, right? There's going to be applications that you have to fill out. So, just to put that out there. I had one question, and we're done because they already popped in there and told me to stop. So one person said, I would like to learn tools on how to navigate my finances. I think we kind of covered that, but I didn't want to ignore the question. Again, American Cancer Society does have it may be online, and ours has it in person, but they have a class on financial navigation, navigating when you have cancer. They have this really thick folder. In that folder, there's booklets and there's templates that you can use. You can write down your co-pays, your co-insurances, what you've paid, and several other things like that. But I'm rambling, so I am done.
Yolanda, I was gonna add to what you just said because we have in the New Orleans area and the region North Shore Prosperity Centers, but United Way has prosperity centers in all the regions in Southeast Louisiana. And those are for helping with budgeting. They also have savings plans. So when they have someone to guide you through some financial assistance. And then we also have community health workers through all of our public health units. So if there's not someone at your particular center or whatever, we do have community health workers. That's one of the programs that we oversee as well, some of the community health workers in our state. So there are other resources. So I'm just going to add to Yolanda just to make it localized.
Just a real quick question. Is there a database that has all the nurse navigators in the United States in it that I could search by zip code, find the nurse navigators in my area?
I'm not aware of a database, but I know the American Lung Association has its own navigators, and you can always, it's like 1-800, it's back there, ALA Lung. You could call them, and that is a national lung navigator that can help you start the process of whatever you need, answer your questions, and also find someone because they do work with local hospitals.
Okay, very good. Thank you.
And don't forget to take some of the literature left here in the back. All right. Thank you, everybody. If you have questions, catch me because I know that.